Hello and good morning. My name is Melinda Salinas and I'm with DC Health. And today I'm accompanied by our director, Dr. Ayanna Bennett, to talk to you about diabetes. Welcome and thank you for joining us to have this conversation today.
Thank you, Melinda, for having me. Thank you, everyone.
So, can you tell us what diabetes is and how does it affect the body?
So diabetes essentially means sugar in the blood. And people who have diabetes have it for a couple different reasons. Either they have sugar in their food, they eat it like all people, but their body doesn't produce the insulin it needs to move that sugar from the blood into their tissues.
Okay.
Your body wants sugar, your muscles use it, your brain uses it. It's not a bad thing, it's a good thing, but you have to be able to use it. So that is one kind of diabetes. The other is that you make insulin, you eat the sugar, but your body doesn't respond to it very well. And so those folks need other kinds of medicine to make their body respond to the insulin they make. Sometimes they need insulin themselves, but that's a second kind of diabetes.
So as someone recently diagnosed with type 2 diabetes, what would be the difference with someone like me with type 2 versus someone with type 1 diabetes?
So someone with type 1 would most likely have been diagnosed as a child.
Okay.
It is something that typically starts in childhood, usually earliest childhood. And that person makes no insulin at all, usually. And that means that they are somebody who takes insulin shots. They monitor their sugar very closely because they can't do anything with it except for the insulin that they take. And so that is somebody who is going to be taking a medication really no matter what they do for the rest of their life.
Oh.
Somebody with type 2 diabetes usually has lived well into adulthood without having to think about blood sugar at all, and then suddenly they do. So that is somebody who now has a chronic disease they didn't have, and they have to learn about moderating their diet. They take some kind of medication, but generally they can change their lifestyle in a way that potentially they could not have diabetes anymore, or at least have very controlled diabetes, and then be able to live with little or no medication. So it can be a very different life.
Yeah.
Somebody who quite intensely knows about sugar and insulin and does this as part of their daily life, and somebody who is maybe changing their lifestyle to try to deal with something, but it usually is of different intensity.
Thank you for explaining the differences between that and what your potential lifestyle can look like.